Health economic evaluation is important because stakeholders of all kinds face scarce resources. And if we're able to use an economic evaluation to inform these real world decisions in a way that uses our resources efficiently, we would be able to help the most or the largest number of people in need, essentially. And to do a good economic evaluation, you need to assess both costs and measures of effectiveness. If you rely solely on costs, you may end up funding something that is less expensive, but also much less effective. Whereas if you rely solely on measures of effectiveness, you may end up funding something that is only slightly more effective, but far more expensive. The advantages to conducting an economic evaluation alongside a clinical trial, as opposed to, say, looking only at secondary data or trying to assess the evaluation solely with a decision analytic model, is that we're able to actually evaluate the data that we observe. In addition, when we conduct an economic evaluation alongside a trial, we're generally part of the trial research team from the very beginning. Therefore, we're able to help design the trial in a way that will allow us to conduct a comprehensive economic evaluation that is going to inform multiple stakeholders. So the primary question that we aimed to answer with this study was we wanted to assess the cost effectiveness of extended release naltrexone relative to buprenorphine naloxone among patients who were interested in pharmacotherapy for opioid use disorder and at the time were enrolled in either an inpatient or short-term residential detoxification facility. Both medications were effective at treating opioid use disorder. In our study, we specifically looked at time abstinent and health-related quality of life. However, the higher cost of extended release naltrexone medication and the additional costs associated with detoxification prior to initiating treatment with this medication resulted in buprenorphine naloxone being the better value for the average patient requiring detoxification before initiating extended release naltrexone. We did also see, though, that the economic value of extended release naltrexone compared to buprenorphine naloxone did start to improve once you looked only at patients who had initiated treatment successfully, whether it was naltrexone or buprenorphine naloxone. And so in the end, if we're able to narrow that cost gap by identifying the best possible patients for each medication, lowering the cost of extended release naltrexone, and shortening or eliminating the induction period, we could improve its relative economic value. That would thereby increase its attractiveness to payers and policymakers and allow more people to access the treatment that they prefer or that their clinical needs dictate.